Hey guys, this is just a top surgery update. I had my surgery on June 24th, so right now I'm 6 days post op, and I just want to tell you a little bit about my process and where I'm at now. So I'm 6 days post op. I got my drains in. That's the worst part about all of this. So I'll just let you see what's going on with me right now. So I got this compression vest on. I got this whole front packed with gauze, and I got these little drains uh, that hooked up. The incisions are underneath my armpits, underneath the compression vest. So tomorrow I actually get my drains out, which is going to be a big relief. That's the main source of my pain. Uh, they gave me Percocet, which hasn't done shit. It actually has been keeping me up at night, or it was keeping me up at night, so I stopped taking it. Now I just take Tylenol, and I still don't sleep very well, primarily because it's really awkward to find a position that's comfortable. Because these things are just causing me a lot of like stabbing pain, and any kind of movement that I make in the night just automatically wakes me up. Uh, so besides that, the procedure I had was I had a peri procedure with Gary Alter in Beverly Hills. My insurance covered it. I have Anthem Blue Cross through my university. So I don't know. I'm pretty sure it's a little bit different if you have it through your employer. So they pay 90% of all my costs. And, I tell every trans guy I see that's looking to go back to school, I might go to one of the UCs, the University of California's. They, I'm pretty sure all of them, they have the transgender health benefit. I pay $5 for my vial of testosterone. Uh, that's easy. I pay $15 for every time I go to a therapy appointment. They pay 90% of any transgender related surgery, up to $75,000. Is your lifetime benefit. So that's like hystos, that's bottom surgery, that's top surgery, that's whatever, um, and it's great. I couldn't have asked for a better way to transition. Otherwise, I would not be at the point that I'm at right now. Um, so yeah, like if you can go back to school, like there's very few ways to get insurance to cover this stuff, and this is one of the few schools that does. So yeah, so I went to Gary Alter in Beverly Hills. He's fairly expensive if you go to him without insurance. I mean, duh, he's in Beverly Hills. But he does specialize in a lot of transgender related surgeries. I had a peri procedure with him. I initially thought I was going to get like the peri, but with like the drawstring method, because I'm like a medium small B, which is pretty borderline for a peri. Also, I'm not a skinny guy. Uh, Most peri procedures you see on like really skinny guys, because they have less skin, less bleeding, less need for revision, etc., etc. I'm 5'6" and 180 pounds, so I'm not small. So I was really cautious about proceeding with this, but I just can't have those scars. Some guys, wear them as a badge of honor. Uh, they would just I would just be dysphoric about them. So, and I don't scar very well, so that's another reason why I decided not to go that route. So with the parry that he did, he made an incision underneath the nipple, but then he also took a big chunk of skin out from underneath that incision and then just kind of pulled it up. So I will still have pleating underneath my nipple, which is like sagging skin, but between 6 months and a year, that all kind of smooths out. And then also you can dramatically increase, the aesthetic look of your peri procedure by working out, and then obviously losing weight. So these are long-term goals that I have anyways, and I'm pretty adamant about going to the gym, so I'm not too nervous about being able to get the best out of my results. And then if I need to go back for a revision, hopefully just a small revision that I don't need any anesthesia for, just like local anesthesia, because that's where your bill starts piling up for that. So yeah, so after my surgery, I responded really well to the anesthesia. I was able to eat pretty large quantities that night. I was starving after fasting for 24 hours plus. Beforehand, um, I didn't get nauseous. I wasn't even really in pain the next day. It wasn't until the day after, so it was 2 days post-op, when I started feeling this pain for the drains. Um, and so since then, just life has been kind of difficult. Sleeping's been hard. Doing anything has been hard. Uh, just getting up off the couch, like I'll lay down for a while and I'll feel comfortable, and then I'll move a certain way, and it just makes your life difficult. I go like between being like depressed and being okay, and that's probably just from this sense of like being helpless. And also, I've been alone most of this time, unfortunately. So that's so the fact that like I would really like to eat, but the effort and the pain that it caused to get up and like make that happen is just like not worth it. So I get these drains out tomorrow, and hopefully that will subdue a lot of this pain and make the rest of this recovery process much easier. So that's happening tomorrow, and I'll update you guys a little bit later, to see, tell you what my chest looked like, etc. I'll be able to take this vest off tomorrow, but I'll still have to wear it. I'll just be able to shower. Um, I really need a shower. It's been so hot here. Um, and I think they'll be able to take the gauze out, so I won't have to wear that as well. And then after that, I'll just be wearing this vest for another week, 24/7. And then the following 2 weeks, I'll just be wearing the vest at night. So that's not bad at all. And I've looked at my chest probably from like the nipples up. I haven't been able to see my nipples. And I don't see any bruising or anything like that. So, I think that there's good signs there. Very little fluid has been coming out of my drains, so good signs there. So I'm just hoping for the best, but really just hoping that this pain will subdue once these drains are out. So I'll make another video probably in a few weeks. Till then, I'm going to continue giving away these binders that I have once I find them. So if you're interested in those, comment on the videos like I specify. So thanks for watching. Up to you guys in a little bit. Bye.